all the sessions are. So today we're going to cover waste elimination. So we're going to look at the process of food and fluid going into the body and all of the parts to do with that through a nursing perspective. So we're going to look at waste elimination. On the Canvas app, it's had a tidy up for this week, so you'll see lots more stuff on there from this morning. Things like how to go to the toilet correctly, how to use a bedpan properly, and all of the options around waste elimination. Because one of the things that we don't do very well in care is continence management. There seems to be a lot of it's okay to use a pad, and the reality is if you were put in a pad, you may feel quite degraded, it's not very dignified. So we're looking at alternative ways of nursing to promote good, healthy continence management. And that has an impact on our mental health and well-being. And of course, it has an impact on our skin and health as well. So there's lots of benefits to making sure that good waste elimination happens properly. Equally, we need to think about some of the terminology that we're going to be using around waste elimination. So it's appropriate to call certain things. And as we go through it, we'll just name it as it is without causing any embarrassment there. We'll then look at extended feeding techniques. So we'll look at somebody who normally eats, and that's why we're going to cover the digestive system first, and the urethra system and urine systems, because we just need to understand a bit of anatomy and physiology before we go on. Then we'll do some PEG feeding. So we'll look at extended feeding techniques, so either through the PEG or through bulbous techniques. We'll then go into continence management. So that's the nursing interventions and what good continence management looks like. We'll move into catheter care. So that's looking at inserting a catheter in a male and female and the processes in which you're going to follow around that. And again, looking at good catheter care is going to be one of the skills that I'm going to watch when I come out to see you. So it's really important that you ask lots of questions if you've never done catheter care before. Equally, you can't practice this on somebody until I've signed you off as competent. But when I come out, I will be bringing models and things for you to have a practice on the practical element, and that's when we do those observation bits. We'll look at condom catheters. So we'll look at the convenes and how they can be used. And finally, we wrap up with stomach care. So again, going back to that bowel elimination and looking at what happens if people have got a problem with their intestines and etc. And some of the reasons why we might use a stoma and what we do around stomach care. So I appreciate that today's session, you're going to know some of this, you may know a lot of it, but we need to go through it so we've got a very clear understanding. So by the end of today, you should have a very clear understanding about what comes into our body and what comes out of the body and the different ways of doing it. And equally, if we can apply some of this back to our practice, think of the benefits in which that's going to have for the people that we look after. So let's start off where it all starts then. So it's the digestive system. And in the digestive system, basically, we eat to survive. The body breaks down the food that we eat and it turns it into molecules. Very simple process there. Goes in our mouth, we masticate and chew, we swallow, it turns into a bulbous, it goes into the stomach, and then it just travels through the body and out through the rectum. That's the digestive system in a nutshell. When you do your professional discussion with me, you will talk about the digestive system, and you literally just need to say that. Mouth, esophagus, stomach, large, small intestines, and rectum, and that's how that shows enough that you understand the digestive system. So, each part of the digestive system releases different enzymes into the food that we've eaten to digest. So, the moment food goes in our mouth, our saliva glands release the saliva to break down the food, and it masticates it and it turns it into a liquid. So it's easy for us to swallow through the esophagus. So there's lots of things that can go wrong here straight away with patients. For example, if the muscles in the back of the throat don't work, or maybe the saliva glands aren't releasing saliva, there's lots of things that can go wrong in the mouth. And equally, if we had those problems, we would refer to the speech and language therapy to try and make sure that we've got the right care plans. So the problem that we have here straight away with food going into the mouth is if we liquidize the food for a long period of time, then those muscles that are in the back of the throat and up here stop contracting and moving. And therefore, actually, it can cause choke hazards and lots of other problems there around those things. So straight away, good oral hygiene, good mouth care, and we can kind of tick some of those problems off as a nursing intervention. As we go down the esophagus, there could be problems there. So again, if you've got a tracheotomy or something restricting the airway, that's going to cause a further problem. As we go into the stomach, where the acids are released. So again, new phenomenon's coming through. People now are having bands, they're having parts of their stomach removed, they're having stomach sleeves, they're having their stomach shrunk. So again, this is going to cause lots of problems later in life, because when you're trying to increase a fortified diet and putting more food in, there are physical restrictions stopping that. So again, it may be the case that we need to look at different supporting techniques to enable somebody to eat around that. Equally, as we go into the intestines there, we can have lots of problems with the intestines. We can have hernias, we can have prolapses. So the hernia is where it kind of pops out and it kind of lifts the skin up. And the prolapses, it can just come out to the body. And you will see what prolapses look like and what double prolapses look like. And we'll talk about how you deal with those through your nursing interventions later on. And then finally, as you go down to the bottom, to the rectum, there can be lots of problems there, such as piles or hemorrhoids or prostate cancers or anything like that. So again, there could be other ways of avoiding the rectum, and that's more looking at stoma care because we're trying to bypass those systems. So just from a nursing perspective, so much happens with the digestive system, and really understand that from an anatomy and physiology point is going to be critical, because if you're going to be putting in catheters, you need to know where the urethras are and what they look like. If you're going to be doing stoma care and you're going to be managing prolapses, you need to know which part of the bowel you're dealing with. And if you're going to be doing extended feeding techniques, you've got to make sure that the right intervention is being used. So if you've got a nasal tube going down, or is it going straight in through a stoma site into the stomach? So actually, there's quite a lot here for assistant practitioners to get their teeth into. In your final exam, in your assessment, you just need to confidently be able to talk about this. Okay, you're not going to be doing it on a cellular level. Okay, that's not the level of anatomy and physiology you need. You just simply need to be able to talk about the mouth, the esophagus, the stomach, the large intestines, and the small intestines, and you should just be able to give that brief overview. So, looking then at the mouth, we obviously know the mouth is for chewing, the saliva glands release that, and obviously it starts to break down the food with those enzymes. So we have a module online called Oral Hygiene. It's just come out. The CQC and the Dentistry Council have, in their wisdoms, come up with the fact that because of COVID, people haven't had dentist appointments, and now there's a lot of poor oral health care going on out there. And the reality is, we didn't really do oral health care that great in nursing and care homes, because we all seem to have a different idea of what good oral health care looks like. So again, just making sure that the mouth is clean, that there's no thrush in there, that it's well lubricated, is all the stuff that you need to be worrying about. Obviously, as it goes into the stomach releases the acids. The acids break the food down, and obviously that creates the enzymes to be released, and that's where the first sort of absorption happens in the stomach. And equally, if you have stomach problems, you'll normally be given a omeprazole as a medication. So omeprazole is normally given if you're taking strong painkillers, because painkillers can cause bleeds in the stomach, it can cause an ulcer. And equally, if somebody's been a drinker for a lot of their life, you may have ulcerated stomachs and ulcerated livers, etc. So there's things there to be thinking about. Equally, the liver obviously covers a part of the stomach and has a great function for cleansing and cleaning. The liver is one of the most self-repairing organs in the human body. If you look after it for a good, a month, there's recommendations of things like doing a milk diet, where milk will clean the liver and help it to get back to a repairing part. Equally, you can take part of the liver away and it will reproduce and grow. So the liver is one of the most resilient organs in the body. And obviously, we need to make sure that that's all being looked after. Into the stomach, like I said, knowing a bit of history about the patient, have they had any pre-ops, etc. And then obviously that goes into the pancreas. And we know that we can live without a pancreas. We know that there's things that we can do there. So again, just a little bit of information around that. The gallstone blocks and the sorry?
It's Sue.
Yeah, Sue, what can we do for you?
I wonder, oh, she's talking to somebody, yes.
Oh, right, okay, we'll put you on mute. So the gallstone blocks, obviously part of the liver and the gallstones. So again, what can happen there is you can get kind of like a calcification and those gallbladder stones can block part of that. Obviously that happens, it can affect the liver and the way that the enzymes are being produced. And if you've ever looked after somebody with gallstones, it can be an incredibly painful thing because obviously the gallstones eventually go into the urethral system, and when you pass them, it can be quite chunky and really painful. And there's procedures there that can be done. So just knowing that you can have gallstones, etc., can cause a problem. And obviously the problem there is the enzymes, the acid that's released into the stomach to help break food down isn't being released because it's got a block. So again, that causes a problem. So the pancreas releases the carbohydrates into the enzymes, and again, that releases it into the small intestine. So again, just having a basic overview of that. You're not going to have to name all the parts. That doesn't happen. Okay. Digestion is completed in the small intestine. So in the small intestines, that's where all the magic happens. That's where it takes out all of the nutrients for the body, the vitamins and all the bits and pieces. And as it's going through there, it obviously travels and then it goes into the large intestines. And that's where obviously the water is extracted from the body. And this is why we need to have about 1.5 litres of water a day just to keep the body hydrated. And obviously part of that is if we have the water, we stop things like constipation. And recently, last year, there was an incident of a young man with learning disabilities, and he died with a burst bowel, and he had only 2 stone of feces in him. So yeah, which is a horrific way to die. And we know with constipation, it releases toxins into the body, and actually that can cause psychosis, it can cause delirium, it can cause confusion. So good bowel care is really important when we're looking after people and knowing when people have been. And obviously, from our assessment tools last week, we would be using the Bristol stool chart and the urine colour charts to keep an eye on everything. Yes. You got a question, Karina?
Yeah, I was looking to find the charts.
Yeah.
Assessment tool charts, and I don't know where to look.
Oh, okay. So if you go back into Canvas, they're under week 1, session 1, where it says assessments tools, and there's a link there that takes you to a hard drive.
Okay. Yeah, I'll try again. Thank you.
No worries. So again, we know that if we're not getting enough water into our body, so if we are putting people on food and fluid charts, we know that there's going to be a knock-on effect. We know that it's going to cause things such as constipation, and we know that it's going to cause things like that delirium, and obviously capacity could be fluctuating based upon this. So there's a lot of things that actually can be avoided with good bowel control. And again, somebody with dementia, it just impedes it. It just makes things a lot worse. Those symptoms are more exacerbated. So basically, digesting food goes in the mouth, gets masticated, broken down, going to the enzymes, goes into the stomach, releases the hydrochloric acids and breaks it all down. The bile is produced in the liver, which obviously is part of the gallbladder. That helps break down the fats. It then goes to the pancreas, relieving the carbohydrates of the lipsides of the enzymes of the small intestine. And from that, it moves into the large intestine to come out the rectum. That's the journey. You don't need to know all of that. But actually, when you think about it, it's not that difficult to kind of piece this in your mind for the digestive system. Any questions on the digestive system? Happy with that? Marvelous. Okay, so the next one we're going to look at is our urine system. So our urethras and kidneys and all of that lot. Let's just get this one up. I'm going to give you a quick overview of this, just so again, we've got the systems in, we understand how those systems work. Okay. So the urinary system is another one of our 11 systems in the body. As you go further down, there's a whole module on anatomy and physiology, but as we're going through it, it links up anyway. So the urinary system, you need to have a fairly good idea about the urinary system if you're going to do good continence management. And especially when you're going to be putting in catheters and taking catheters out, you need to have a really good idea about what you're putting in and what happens into the body when we start doing that. So the functions of the urine system is obviously to eliminate waste products, get rid of the toxins, get rid of the drugs and anything that's going into the body. So what's interesting with medication and the urine system, depends on how much people are drinking, can alter the chemistry of the medication. So if you've got somebody who's drinking a lot of water, and especially things like lithium or your risperidones, which are used in mental health or dementia, if they're drinking too much, you can be flushing the medication out of the system, because obviously that's what the water system is designed to do. It's designed to release those toxins. So therefore, the medication loses its therapeutic benefit. So you need to make sure that if somebody's drinking too much water, it can have the adverse effect. And equally, in water is sodium. So people that drink an excessive amount of water can cause hypertension and high blood pressure, because actually there's sodium in the water that increases that. Equally, if you drink too much bottled water, it can cause jelly bellies, because again, in bottled water, it's normally treated and they normally have a lot more, it's a lot higher in the minerals. And again, too much of that, the body starts to secrete it and try to clear it. So there is this fine balance with water. We need enough to sustain, we need enough to clean our bowels, but too much can actually cause us a problem as well. And again, if you think about people where they get the oedemas and they get water retention and holds and all of that, lots of problems if we've got issues with the urine system. So the function of the urine system regulates aspects of homeostasis. Do we know what homeostasis is? Have anyone heard of that phrase? So homeostasis is going to be a friend of yours. You're going to hear it now all the time. Because when we do vital signs, it's all about homeostasis. And basically what homeostasis is, it's the ability for the body to regulate itself. So in other words, if I'm hot, I sweat, that's homeostasis, that's the body trying to cool me down. If I'm cold, I shiver, that's signs of homeostasis, that's the body trying to warm me up. So if I cut myself, I bleed, I normally congeal, that's homeostasis, that's the body trying to repair itself. And again, part of the homeostasis with the urethra system is it's clearing away those toxins for the body to work properly. And as a nurse, what we are interested in is full homeostasis across the body. So in every part of anatomy and physiology, in all the organs and everything the body does, we want it to be working at an optimum level, and therefore we should understand what normal signs are, because that's what we're trying to get the body back to. Okay, so that's just a little bit about homeostasis. Equally, it regulates the amount of water we have, it does the electrolytes in our body and how we pass water around our body. It obviously links up to our blood pressure, because there's water in the blood, and those systems are obviously interlinked. And obviously it looks at how we absorb vitamin D as well into the body through the urethral system. So actually, somebody who's got a water infection, somebody who's maybe retaining water, we could be thinking there's a problem with their vitamin D. And obviously vitamin D is all about good cell repair. And we know vitamin D is also responsible for mental health and serotonin and the happiness. And that's why some people get the sunlight affective disorder of the SAD, because it's got that lack of vitamin D. People who are also in institutes, so people that are in hospitals for long periods of time or care homes, can also lack vitamin D because they're not going out and getting natural sunlight. They're just normally stuck in a care home or in their bed. So as a nursing intervention, you could always think about giving somebody vitamin D just to pick up their mood and encourage good cell repair, because that's what vitamin D does. And without that, you're going to really struggle if you've got wounds or pressure sores. So this is as much as you really need to know about the urine system. It's got our kidneys. As we go down, you've got your bladders, and then you've got your urethras. What is the difference between a male and a female regarding the urethra? Do we know? It's okay if you don't. So there is a massive difference between a male and female regarding the urethra system. Anyone want to have a hazard guess what it is? No, it's fine. So basically, the male's urethra is longer because obviously they have the extended part. And that makes a difference when we're looking at catheter care. Equally, we are now entering that new phenomenon again about people changing their body. So again, a bit of patient history is going to be really important, because if you've got somebody who's maybe gone through a transsexual or an operation, or they've got a designer vagina, it alters parts of what's going on down there. And that makes it a bit harder for us as nurses, because there's other things going on down in the urethra. Equally, this is where your safeguarding and your prevent head comes in. You can have things like the mutilations, you can have vaginas that have been stitched up, you've got lots of things going on there. So good invasive care techniques is really important, because actually, if you're not looking at the areas in which you're nursing, so either you're washing, cleaning, it could just be something as simple as that. If somebody's had their vagina stitched and maybe there's problems there, it could cause problems with urinating because they could have pain. There may be assaults going on. So there's lots of reasons why people could be not urinating properly as well. So we just need to be thinking about, actually, I need to get over any embarrassment around the penis or the vagina, and I need to be confident in what I'm looking for. And if I'm concerned in any way, I know the channels in which I can go down to report it. Because actually they all have different nursing techniques if they do. So locations of the kidneys. So if you're distilled, your body's against the wall, it's down by the lower T12 and L3 lumbar, so down kind of at the bottom, right sides that you saw there. And obviously we know the kidneys are responsible for cleansing and keeping those blood vessels nice and fresh and kind of up to date. And obviously we know that in common health conditions, if you had kidney failure, you're going to end up on dialysis and things like that. So again, a whole nursing intervention in its own right. We can live with one kidney, because obviously you hear a lot about people that have given their kidneys away, etc. But obviously, if we don't have good kidney working, what happens to the body if we've started to get kidney failure? Do we know what happens to the body?
You will be in pain, and you can cause kidney stone.
You get kidney stones, you're going to be in pain. What would the body look like? What happens to the skin tone? It's a really simple way to identify if someone's got kidney failure. No, so they start to go jaundice, they go yellow. So the skin becomes completely yellow. And that's because the ketones, all of that lot in the urine isn't being cleansed properly. And that yellow dye pretty much starts to come out in the skin. And it's that jaundice look. And equally, that is a sign of end of life as well, because we know when we're dying, our organs shut down in a specific order. The first organ to shut down is the stomach, because we don't need it. Okay? The stomach isn't a really important organ in the big wheel of life. So that's the first organ to shut down. And that's why whenever we have something wrong, we want to be sick. So it's the body preparing for homeostasis. So that when people say to you, I feel sick, that's the first indicator for you that actually maybe something's not quite right. If you then start to see obviously the skin changing colour, then that would probably indicate that the kidneys are shutting down because they're not being cleansed. And it happens quite quickly because obviously the kidneys are responsible for cleansing litres and litres and litres of blood per minute through the body. So again, when it does happen quite quickly. So it just gives you things to be looking at that are other common health conditions. Okay, so we know what a kidney looks like. It looks like a little kidney bean. And obviously, if you slice it away, you can see the red veins and cells there. So that's for the oxygenated blood going in. The blue one's normally for the deoxygenation of things coming out. And it just gives you an idea. You don't really need to go into a great deal around the kidneys. You just need to know their function is for cleansing and purifying the blood. Okay, that's really all you need to know. So it gives you a bit of an idea about what's going on there. Obviously, it's just the blood going through those processes. Again, you don't need to know this. We don't need to know that. You don't need to know about the renal tubes. You don't need to know about that. You don't need to know about that. You don't need to know about that. Reabsorption. You don't need to know about that. Right. So on the bladder, then, as we go down, this is a picture, just a rough picture of the bladder. And in there, you can see down at the bottom, you've got the urethra, you've got the bladder wall and the bladder there. The bit around the bladder there is the bladder wall. So that's the muscles that contract and tell us, sends the messages to the brain, I'm full, I need to empty my urine, or you know, I need a wee. So if those muscles aren't working and we lose that signal, that's a reason that some people have that water retention, because they're not getting that signal. They're not, there's something that's gone wrong there. But what we're looking for there is when we look at catheterization later, as the catheter goes into the bladder through the urethra, the balloon bit sits at the top. And then we can start to understand why catheters can get blocked, why they look like they've got blood in them, and why there's lots of sediment. And the sediment, the bits that are in catheters that you tend to see, is from the bladder wall, and obviously that causes the catheters to get blocked, and that's why we then had to start doing lots of flushes and things like that. But again, it'll make more sense when we look on there. So again, the urethra there. So the urethra is obviously a thin walled tube carrying urine from the bladder to the outside of the body, releases urine, and obviously it's to do with the muscles either contracting and releasing involuntary or voluntary. So sometimes if that muscle wall is lost, that's why when we cough, sometimes we can leak. Because obviously there's a loss in that muscle, and actually there's some things we can do that helps good bladder control. So those pelvic muscles where you can kind of push it in can start to tighten up pelvises. Equally then, if we've had a catheter and we take the catheter away, the body's lost all of that memory. It's lost the memory of how to hold urine. So actually people that urinate after a catheter, it's because they've lost that memory. The muscles have gone and they've lost that memory. So we need to retrain people how to use their bladder, how to recognize when they're full and how to recognize when to go. So there's lots of education that's needed for people with catheters. So the urethra differences here. So you can see there, female is 3 to 4 centimeters, about an inch, and the male is about 8 centimeters or 8 inches. So that's the track. And actually it's useful for you to know that, because when you do start to insert a catheter, sometimes you can feel you're going on forever and you think it's never going to end. And sometimes it seems to go in quite quickly and you're like, oh, is that in? But we'll talk about that in a second. The other problem that you have is the location of the urethra. So with the female, it goes alongside the wall of the vagina. The problem with men, they also have the prostate gland, and the prostate gland can sit on top of the urethra at times. So if you're catheterizing a man and that catheter, the Foley, isn't going through the urethra, it could be that the prostate is sitting on top of the channel. And actually, just by getting them to cough and move, you can lift the prostate a little bit. Equally, if you are struggling to catheterize a man, it might be worthwhile them having a prostate check, because they may have an overactive prostate, they can have prostate cancer, and just knowing some of this makes it a bit easier for when you are catheterizing to what some of those barriers could be. Okay, so normal amount of water in the human body. For young adults, you're looking around 50%, males 60, babies 75, and older age at 45. So we know that we need a certain amount of water in the body, and ideally we should be aiming for that 1.5 litres as a minimum, up to 2 litres a day. And the reality is, we know in care homes that can be quite tricky at times, especially if you're having to help somebody, because they normally only get 150 mils a time or 250 mils a time in those little cups. So actually it's quite a task to get people to that 1.5 litres, isn't it? You'd almost feel like you're spending the whole day just supporting somebody to drink. And that's why in hospitals, people tend to be put on IV drips, because actually it's a quick way to get the water in the body keeping hydrated. I'm not going to cover that, okay, because that's not relevant to what we're doing. I think that's all you need to know. Okay, so we've done the overview then of the digestive system. We've looked at the urine and urethra systems, and we just need to hold some of that in our minds as we go through the next sort of presentations, because obviously that basic knowledge is going to help now when we look at the extended feeding techniques and obviously managing continence. Are there any questions on that first block, or are we happy with that? Yeah, happy with that? It's going to be those, if you don't speak, forever hold your peace, and I assume everything's okay. Right, so